Are there different types of amyloidosis?
There are many different types of amyloidosis. The most common one here in the United States is one called light chain amyloidosis, which is the one that's most relevant to multiple myeloma. But then separately, another very common type here in the United States is called transthyretin or TTR amyloidosis. And that's one that actually, interestingly, has nothing to do with myeloma or light chain amyloidosis or plasma cells. It comes from a completely different place. And then there are many other types of amyloidosis that we occasionally see here in the United States, but they're extremely rare. So by far the most common types here in the United States are light chain and TTR amyloidosis.
Are people with kappa myeloma more likely to get amyloidosis than lambda myeloma?
So the predilection of different light chain varieties to cause amyloidosis. So if we look at the light chains that are present in different people with amyloidosis, it's about 2-to-1 lambda to kappa. And a lot of this is probably driven by the fact that the structure of that light chain protein is probably what determines how likely patients are to develop amyloidosis or not. And this has been reported preliminarily by Mayo Clinic, where they were able to basically sequence light chain proteins, so not only say kappa or lambda, but tell you specifically the actual sequence of that protein. And they were able to show that patients that had certain sequences of light chain protein were more likely to develop amyloidosis, and specifically involvement of the heart, the kidneys, different organs. And so it makes sense, again, that the sequence of the protein is really what determines how likely a person is to develop amyloidosis, and then beyond that, what organs it's likely to hit. And so there's something about that lambda light chain sequence that's a little bit more likely to form amyloidosis than kappa light chain, but both can do it. So kappa doesn't mean we're off the hook.
Are people who have light chain myeloma more likely to develop amyloidosis than those who have heavy chain?
So are patients who have light chain amyloidosis more likely to develop amyloidosis? Not necessarily. So in theory, yes, and that you really need light chain to form amyloidosis, but patients who have heavy chain multiple myeloma, so basically an identifiable M spike, they can form amyloidosis just as readily. But yes, it is a little bit more common to have free light chain for patients with free light chain myeloma to develop amyloidosis.